Hello guys, welcome back to my channel. So you can see by the title that I will be doing a review of electrolytes for your NCLEX exam. Before I get into it, I just want to say thank you to all my new subscribers. Thank you for joining my channel. And before we get started, make sure you subscribe, like, share, and leave a comment. Today we will be reviewing 3 electrolytes: sodium, potassium, and calcium. So everybody knows that I'm mnemonic king. So when it comes on to memorizing lab values, specific information, I'll make a mnemonic and it will make it that much easier for me to remember. So work smarter, not harder. Alright, we are going to start off with sodium. So before we can look at the abnormals, we need to know the reference range for the normal. Alright, so sodium, we know that it is 135 to 145 milliequivalents per liter. Again, the normal reference range is 135 to 145 milliequivalents per liter. Make sure you check back with whatever study guide that you are using for these lab values, because as I usually say, lab values do vary from book to book. Alright, we say that a person has hypernatremia if their serum sodium concentration is greater than 145 milliequivalents per liter. So what are some causes of hypernatremia? Excess fluid loss, excess sodium intake, heat stroke, and we have diabetes insipidus, or too much hypertonic solution. So this is where we get to the fun part for the signs and symptoms, because it's a lot to remember. What I did, I just made up some mnemonic, and that helped me memorize the more common signs and symptoms of hypernatremia. So let's start with the mnemonic first. The mnemonic is DRWS TNT, so DRWS-TNT. Alright, again, DRWS-TNT. So let's go through them real quick. Signs and symptoms. We have dry, swollen tongue, restlessness, weakness, sticky mucosa. The temperature, is the temperature going to go up or down? It's definitely going to increase. We have neurologic change, and we have increase in thirst. So what are some management to correct, or what are some interventions that can be used to correct hypernatremia? The first thing is to definitely decrease your salt intake. We want to give a hypotonic solution. Again, a hypotonic solution, or D5W. So with D5W, it can be an isotonic solution, but once the sugar is absorbed in the body, then there's free water left. So that will kind of dilute out the excess sodium in the blood. So let's move on to hyponatremia. We say that an individual has hyponatremia if their serum sodium concentration is less than 135 milliequivalents per liter. Alright, what are some causes of hyponatremia? We have adrenal insufficiency. So there's a decrease in your aldosterone. Aldosterone, you know that it helps you retain sodium. If you do not have enough aldosterone, then you're going to excrete too much sodium, and you will become hyponatremic. Other causes of hyponatremia include syndrome of inappropriate antidiuretic hormone, fluid loss via diarrhea, vomiting, sweat, and H2O intoxication. Alright, so mnemonic time. The mnemonic for hyponatremia is BNP HANDS. So BNP HANDS. Yes, it's a lot, but with a mnemonic you can memorize it easily. So let's get into it. Decreased blood pressure, nausea, poor skin turgor. HANDS. Headache, abdominal cramping, neurological changes, dry mucosa, and decreased salivation. The most common management for hyponatremia is restrict water and increase your sodium intake. Alright, again, restrict water and increase sodium intake. Let's move on to hyperkalemia. So this is your potassium. So the reference range for potassium is 3.5 milliequivalents per liter to 5.0 milliequivalents per liter. So again, 3.5 to 5.0. So we say that an individual has hyperkalemia if their serum potassium level is greater than 5.0 milliequivalents per liter. So what are some causes of hyperkalemia? Impaired renal function, tissue trauma, hypoaldosteronism, and acidosis. What are your signs and symptoms? So the mnemonic for that is DMRAPG. So DMRAPG. DMRAPG stands for Dysrhythmias. That's one of the most crucial signs and symptoms you must look out for. So dysrhythmia, muscle weakness, respiratory impairment, anxiety, paresthesia, and GI manifestation. GI manifestation could include your diarrhea, your vomiting, so any type of GI changes you can look out for. The management or intervention for a person who has hyperkalemia is definitely EKG monitoring. You also want to decrease their potassium intake, and they will also be getting sodium polycitrine sulfonate, aka K-exolate. They also may get IV calcium gluconate, regular insulin, and hypertonic dextrose. So you say, why is someone getting insulin and they may not be diabetic? So what insulin does is drive the potassium out of the intravascular space and put it into the interstitial space. So again, you may have to give them regular insulin with dextrose because the dextrose will help prevent hypoglycemia. In addition, the patient might be prescribed a loop diuretic, and that will help to get rid of the excess potassium. Alright, let's go to hypokalemia. This is when your serum potassium concentration is less than 3.5 milliequivalents per liter. Some causes of hypokalemia include hyperaldosteronism, decreased intake of potassium, and GI loss. So signs and symptoms. The mnemonic for that, this one is a little complicated, but we'll get it. So it is DM times 2, pack G, F, and V. Again, DM times 2, pack G, F, and V. So these signs and symptoms include dysrhythmia, decreased deep tendon reflex, decreased muscle strength, muscle weakness, paresthesia, anorexia, cramps, glucose intolerance, fatigue, nausea, and vomiting. Again, it's a lot, but with the mnemonic, you will definitely remember it. So what are some management for a person who is experiencing hypokalemia? You definitely want to increase their dietary potassium, and they might require IV potassium. Keep in mind, with IV potassium, a common side effect of that is a burning sensation. If the patient complains about a burning sensation, you may have to decrease the infusion rate, so please keep that in mind. And the last one for today is hypocalcemia. So our reference range is 8.5 milligrams per deciliter to 10.5 milligrams per deciliter. So a person has hypercalcemia if their serum calcium concentration is above 10.5 milligrams per deciliter. Causes of hypercalcemia includes malignancy, hyperparathyroidism, and bone loss related to immobility. If you're not moving, your bones are going to break down. What is the bones made up of? Calcium. So we will have a serum concentration increase. Our mnemonic for the sign and symptom is MIA, missing in action, CNA, and B. So MIA, CNA, and B. The and isn't a mnemonic, it's just like to add the B on there. But yeah, you'll get it. DEPT V. So DEPT V. So again, MIA, CNA, and B, DEPT V. So let's get into it. Muscle weakness, incoordination, anorexia, constipation, nausea, abdominal and bone pain. So that's where the A and B comes in. Dysrhythmia, EKG changes, polyuria, increased thirst, and vomiting. So what are some management? Definitely treat the underlying cause. Increased fluid. They might be getting furosemide and calcitonin biphosphonate. This calcitonin biphosphonate will help to move the calcium from the blood back into the bone. Hypocalcemia, this is when the serum calcium concentration is less than 8.5 milligrams per deciliter. Some causes include hypoparathyroidism, malabsorption, pancreatitis, alkalosis, massive transfusion of citrated blood, renal failure, and some medications. So what are some signs and symptoms of hypocalcemia? So we have star CC fat, alright? STARCC, and this is not your regular fat. This is spelled with a P, so PHAT. So you may have seizure, tetany, abnormal clotting, and respiratory complication. This includes laryngospasm and dyspnea. CC is your positive Chovstek and your circumoral numbness. Paresthesia, hyperactive deep tendon reflex, anxiety, and positive trochlear sign. So some treatment: oral calcium, IV calcium. Keep in mind you have to administer IV calcium slowly because it can cause dysrhythmia. Vitamin D and phosphate binders. Thank you for watching this video. I hope it was helpful. If you have any questions or comment, leave it in the comments down below. Remember to subscribe, share, and like. And once again, all the best and good luck.